Milwaukee is unfortunately #1 in the country for segregation. We are also nationally known for our high eviction rate. And so the invisible or unknown people that iCare serves are the ones impacted by this unstable housing, unstable food sources. They're food deserts. The only stores available are convenience stores that sell alcohol and junk food and cigarettes. As a nurse, I can say to someone, I really want you to eat healthy. I want to make sure you get enough protein. Where are they going to get that? How are they going to get that?
I live month to month, day to day. But I wouldn't have a life right now if it wasn't for the help that I got from Miss Lisa Brooks. She's been my guardian angel.
Community health workers are the front line to any organizations that is looking to eradicate or eliminate these social determinants of health. With iCare in general, we go into the homes as community health workers and we assess what those social determinants of health, whether it's food insecurities, whether it's utility insecurities, or whether it's a need for more medical med management. Whatever the need of that member, if we can address it and take it, housing is a big one, for instance. If we can address those basic, just human needs of an individual, then we have made an impact and we are able to give them a better chance at accessing things such as health care.
I came out of a nonprofit environment. And so I brought that element to the party, how to build community connections, the importance of building those connections, radiating compassion, thriving together, inspiring well-being. The only person that spends 24/7 with our members is the member themselves. And so to what extent are they part of the care plan? How do we get that contribution from the member is part of inspiring well-being and understanding how to motivate the member to self-activate, to become a contributor actively instead of passively, maybe even resisting or denying that they have a condition that needs their own attention.
My visual impairment is retinitis pigmentosa. So basically it's the retina that's behind the eye that's deteriorating, it's going away. Eventually I will lose my sight. Living at my dad's house was getting kind of, tough, so I was ready to move. So I was working with a counselor named Tanisha. She was somebody who met me at the homeless shelter and we had a very honest and very real conversation. And then there I met a woman named Miss Lisa, and the things that they were telling me were the concerns they have about me living on my own, but also the reasons why I should live on my own, and just encouraging me to do it and that I can do it. And I felt more secure having that back up there with her and Miss Tanisha.
We're building this one project just for our members who are constantly going to the emergency room. The initiative was to figure out why they're going to the emergency room and try to get that assistance for them. That's what we're there for, to connect them, build a bridge so they understand that they're not the only ones doing it. We're advocating for them. We're stepping in, speaking for them when they don't have a voice.
As a paramedic going inside of people's homes, we were just responding on a 911 basis and taking people to the hospital and then seeing them again and seeing them again and so on, and never really fixing or being able to create a better environment for them. We could report that we saw something in the home that was bad, poor conditions and that sort of a thing, no utilities, no power, children without beds and those sorts of things. But we really didn't know if anything was being followed through. And becoming a community paramedic, you get to see that. You go back to the homes, they're allowing you to come back in, they have that trust with you. You're able to provide those things for them to show that there are people out there that care. iCare and our fire department community paramedic program are like-minded. They have a background in other agencies that they've worked with besides just being in the insurance agency. And so they bring that wealth of knowledge with them. and we learn from them as much as they learn from us. And we're able to apply that and get the member or the patient a better understanding of why they have to take the medications they have to take, why it's important to keep their appointments with their doctors, and those sorts of things, just to follow through and be better as a whole.
She called me and told me that she was assigned to me, a caseworker. And at first, like I said, I was nonchalant about it. But then I agreed to meet her. I told her, expressed to her about my life, pretty much. And she was proud of me and she totally understood. You know what I mean? And I was grateful to have her ear. It touched my heart because she took it out her time to call me. All the time, do you need any help with any kind of resources, or should I send you some pamphlet work? So it was amazing that she got so many resources that helped me.
It's that connection you don't get every day. And they might say it's old school, but it still works. They're at home and they want to hear May call, so they can pick up the phone and tell me no emergency visits, no hospital stay.
If you stay in contact and you call up the person and say, "Hi, how's it going?" Oh, you missed your appointment. All right, well, let's take care of that. You never respond with shock or judgment. You respond with, all right, what do we need to do now? So the program launched in July of 2017, and they looked at the first 83 members that went through the program. And they looked at their costs prior to the hospitalization for 12 months and their costs after discharge for 12 months. And this program has saved iCare over $1 million for 83 people. And it is that human connection, it's that human touch, it's someone saying, I want to know how you're doing, can I help you out?
Health is everything. It's an awesome feeling when you know that you can pick up the phone and you know that someone will respond right away. It's a triple plus when you have a team and they're concerned and you have built up a relationship with them.
All of our members are either on some type of Social Security or Social Security from the state, so we need affordable housing. And this has been the issue that I've come across with all of our members, needing that affordable housing, which means something that they can afford and not be house poor.
What I love about iCare and about Milwaukee is that we have a reputation. People know that we will go above and beyond to help our members. And it just leads to some really amazing opportunities.
To come and be there to say that she knew I was in trouble, needed help. She was there to help me in any way she possibly could. And she did. She stayed there until I had a place to move into, a place to set up home again. And then come back and check on me to make sure I love and enjoy my home. So, I do. I owe everything to her. I do.
That idea of activation at the lowest level, contributing at the lowest level, not resisting passively, is not only about our members, but even the line staff here that can't be told what to do. They have to know what to do. They have to want to do it. The member can't wait.
Do what you know how to do. It doesn't take Milwaukee corporate to tell you what to do. Do what you know how to do. It's about someone like Lisa Brooks saying, I'm going to look into this housing thing. I have an idea. Or Mari saying, oh, you want us to make a connection at the emergency department? I know how to do that. So, and I could keep going. I could list all 330 names and tell you what makes them unique and why they're here at iCare. So I think I have to have some faith that if you plant the seed and you grow it and you nurture it and you give it what it needs so that the staff themselves feel in relationship no matter where their office is, then I think we can be successful.
That special sweet sauce for iCare, I say my team is. I'm very fond of my team, and we're just so cohesive. If we can take our team and bring everybody around and understand what we do, I think that's the sweet sauce.
It's like a latching on. When they find out what we can do, you get those questions, well, what about? Well, what about? We have answers and we have information that they need and can use. What you would see is what I call a blossoming effect, where you could see them climbing out and then rising to where their head's no longer below that water. When you see that face and they look around and they go, oh, this is what sunshine is. This is what the real world is like. It's a true blossoming. And if you've never sat and watched a flower blossom, take the time. Don't just smell the rose, but watch the rose bloom. You'll be amazed at all the little things that it does in order to give you that perfect picture that you smell.